The 2026 Sleep Champion Award honors CHI-PAP, part of community health, for advancing access to life-changing sleep care.
Community health really prides itself on being patient-led or community-led, and so we listen to our patients' needs. A lot of them were being diagnosed with sleep conditions. When Dr. Fiala offered his services to us and told us to dream big, we said a sleep clinic would be something amazing.
What inspired me to start the CHI-PAP program was that during my sleep training, I realized that it was really difficult to get resources and treatment for patients who may not have connection to insurance in traditional medical care. Success in the CHI-PAP program is a patient who comes to us from primary care, undergoes testing, maybe gets a diagnosis of sleep apnea, and then gets treated, is thriving on their treatment, and then is retained in care, meaning that we're following them up and we see that they're benefiting from their therapy. Receiving the 2026 Sleep Champion Award means everything to us. To have the funding from the AASM Foundation is huge.
It's just so impactful to receive the funding that allows us to, as we like to say, turn every $1 donated into $7 worth of healthcare.
I'm really proud of the way that the CHI-PAP program has grown organically over time. It really utilizes the goodwill of the community around us. Really, people who have reached out and made donations of old but functional CPAP machines, unused supplies. These are the things that allow us to provide care to our patients.
Our pillars are volunteerism, philanthropy, and partnerships, and CHI-PAP kind of embodies all three of those in one, since it was born from this incredible volunteer and his innovative approach.
One story that comes to mind that really is a success for the CHI-PAP program is a gentleman who came to the clinic screened positive for lots of excessive daytime sleepiness. So I come over, get him set up with a BiPAP machine because his sleep study looked particularly severe. And I remember putting it on him and titrating the settings a little bit. And I'll never forget it. We have the mask on him, the air is flowing in and out. You see him syncing with the machine. And I just see him kind of melt into the seat that he's in. And he dozes off. And I nudge him gently and I said, hey, sir, are you feeling okay? He says, yeah, I feel like my chest is just lighter. Having a lightening of this stress with the treatment that we're giving him was really impactful. And I think in that moment I knew, like, wow, you're really going to be a success story. And you're the reason we're doing this type of clinic. If other providers want to start a clinic like this, first off, I would say, don't be afraid. Dream big and be smart about it, right? Start thinking about who you have available to you in terms of community partners, because they're going to be key. But if you can find a good community partner, the sky's the limit.